Now we start with team coverage on the issue between Mayo Clinic and Minnesota lawmakers. KIMT News 3's Sananda McCall is digging deeper into the crux of the issue, and we also have KIMT News 3's Max Haslow live in St. Paul for us, where earlier today nurses employed by Mayo Clinic Health System spoke about conditions and how they are dealing with work. But we start tonight with Sananda.
Yes, Tyler, the divide stems from two legislative bills that are already being ironed out by the Minnesota House and the Senate. They are the Keeping the Nurses Act, at the Bedside Act, and its partnered bill to implement a healthcare affordability board and advisory council. Keeping Nurses at the Bedside Act is promoted by the nurses union and would require all hospitals across the state to form committees made up of nurses and other hospital staff to create core staffing plans. Now, this would also include placing a maximum on the number of patients each nurse can care for safely. As the bill is in the process of heading towards Governor Walz's desk, however, the Mayo Clinic is asking for an exemption. Mayo's argument is that the bill could increase healthcare costs, among other concerns, and the MNA argued that the bill would save money for health facilities across Minnesota, reduce burnout, and ensure each patient receives quality care. In a statement the Mayo Clinic released today, they say they've worked with policymakers for several months on proposed changes to the Keeping the Nurses at the Bedside Act legislation that would provide a more comprehensive approach to address nursing shortages while ensuring Mayo Clinic can continue to fulfill its mission, and that they value input from its nurses. However, the bill does little to address challenges, recruitment, and retention of the healthcare workers and staff Minnesota's need. Tyler?